Hello, welcome, welcome. Bienvenue, 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 bienvenido. Today, we are going to talk about a visual guide to herniated disc. What is a herniated disc? The bones of your spine, called vertebrae, are separated by rubbery discs. If one of them tears, you have a ruptured disc. When the jelly-like substance inside leaks and pushes in a nearby nerve, it's called a herniated disc. What causes? It's often hard to know exactly what makes a disc break open. It could be that you lifted something heavy and strained your back. A simple awkward turn or twist could do it, or even a fall or sudden hit to the body. Sometimes it's just aging. As you get older, your discs start to lose water, which means they don't flex as well as and may tear more likely. What are the symptoms? You might notice sharp pain that shoots from your rear end down the back of your leg. Your leg or foot could feel weak, numb, or tingly. In the neck, a herniated disc can send pain, tingling, and numbness down your arm and into the muscle between your neck and shoulders. Who gets it? You're more likely to tear a disc if you lift, push, or bend a lot or do the same motion over and over. Think of a warehouse or delivery worker sitting all day in the same position as many office workers do can also do it. It happens more after middle age, and if you're overweight or a smoker. Some people inherit genes from their parents that lead to this problem. How is it diagnosed? Your doctor will ask detailed questions about your symptoms and test your reflex and muscle strength. She might rub, touch, or prick your skin to see how much you can feel. You may also need to get some imaging tests like an X-ray, CT scan, or MRI. Which medications help? You can start with over-the-counter meds that lessen swelling and pain, like ibuprofen and naproxen. If you're hurting a lot, your doctor may prescribe stronger drugs like narcotics, anticonvulsants, and muscle relaxers. To curb inflammation around your herniated disc, you may need to take steroid medicine by mouth. Your doctor might also inject steroids into your back to ease swelling near the disc. Cold and heat treatment. Try an ice pack at first to ease pain and swelling, but don't use it for more than 20 minutes at a time. In a few days, after any muscle pain spasms settle, you also can switch to some gentle heat to relieve pain. Physical therapy. If your back still hurts after a few weeks, your doctor might send you to a therapist who can show you a set of exercises that take pressure off the nerves. This often helps strengthen your back and stomach muscles. It's best to get an expert to instruct you on the right way to do them so you don't re-injure yourself to make your symptoms worse. Surgery. Most people won't need surgery, but if you still have serious pain, numbness, trouble walking, or bladder problems after 6 weeks of other treatment, it may be time to consider it. The surgeon may remove part of the disc where it pushes on any nerves, and the neck, the surgeon may take the whole disc out and replace it with bone, and sometimes a metal plate for support. Complications. Just past your waistline, your spine divided into a group of nerve roots called the cauda equina. In one cases, a herniated disc can push on this cluster. You might lose control of your bladder and bowel movement, and you might need immediate surgery to prevent permanent damage like weakness or paralysis. Go to an emergency room right away if you notice the symptoms or if you lose feeling in your feet, legs, or genital area. How to prevent trouble. There are no guarantees, but there are things you can do to keep your disc in good shape. It helps to stick to a healthy weight to keep extra strain off your spine. Try to avoid doing the exact same motion over and over again. If you sit all day, try to get up at least every hour or so and move around to take pressure off your back. Good posture. You lessen pressure on your spine and this if you keep your back straight, particularly when sitting for long periods. When you lift heavy objects, you should mostly use the muscles in your legs, not your back. If you're not sure exactly how to do this, your doctor or a physical therapy can help. Talk to them. They will instruct you. Thank you. I appreciate your time. Please remember to like, subscribe, and share this information and put the notification bell on so you can be having my next video for the helpful healthy tip information passing around coming directly from WebMD, presented to you by Lynn from Natural Wellness Center of Health.com. Remember to visit the website.